Namaste viewers, welcome to Sri Ananta YouTube channel. In this episode, let us ask Swamiji about ischemic stroke. Swamiji, can you please tell us the causes and the reasons of ischemic stroke?
Embodiments of law. Today I am going to discuss about ischemic stroke. Many of the patients who visit to our hospital, they would like to know what is ischemic stroke and how it causes. So let us discuss about what is ischemic stroke and let us explore the knowledge so that all the patients and people in common or the students who want to learn about the ischemic strokes in detail, they can have this video. Now, why this ischemic strokes occurs, that I am going to tell. Ischemic stroke is caused by a blockage or obstruction in the blood vessels that supply blood to the brain, resulting in a lack of oxygen and nutrients. There are two main types of ischemic strokes which are as follows. One is thrombotic stroke. This type of stroke occurs when a blood clot forms in an artery that supplies blood to the brain. The clot usually forms in an area of the artery that has been narrowed, called atherosclerosis. Thrombic strokes can occur over a period of time as the clot gradually grows larger and obstructs the flow of blood in the brain. Now, the second stroke, we call it as embolic stroke. This type of strokes occurs when an embolus, which is a blood clot or other material that has formed somewhere else in the body, travels through the blood streams and lodges in an artery that supplies blood to the brain. So, emboli can come from various sources such as the heart of the carotid artery. Embolic strokes usually occur suddenly as the embolus suddenly blocks the flow of the blood to the brain. Both types of ischemic strokes can cause similar symptoms such as sudden weakness or numbness on one side of the body, difficulty in speaking and understanding the speech, vision problems, and severe headache. It is important to seek medical attention immediately if you experience any symptoms of strokes, as early treatment can improve outcome and reduce the risk of long-term disability. Hence, what I would like to say is which factors that can occur for the blockage. So, we have the first factor is atherosclerosis, and in other term we call it as cerebral amyloid angiopathy. What is that? This is a condition in which fatty deposits, or we call it as plaques or debris, built upon in the arteries, especially in the arteries, blood vessels, walls, what we can say, that supply blood to the brain, causing them to narrow and harden. Second is bursting of a blood vessel or hemorrhage stroke, what we call. A case is due to aneurysm. Aneurysm means what? Excessive swelling in the wall artery. So whenever there is a excessive swelling in the wall artery, that may burst and lead into leakage. So factors related to the hemorrhage stroke or aneurysm can be uncontrolled BP or anticoagulants, over treatment with blood thinners, aneurysm, swelling in the blood vessels, or trauma, that is accidental cases, whatever that takes place, and cerebral amyloid angiopathy. Cerebral amyloid angiopathy, it is a protein deposits in the blood vessels walls. So these kind of things definitely leads to cardiac arrest also or a brain stroke. Any possibilities can be possible with these two cases. And the third case is a mild stroke, which we call it as transient ischemic attack, TIA. It is a temporary interruption of a blood flow to the brain, usually caused by blood clot or by narrowing of an artery. It Even it's sometimes called a mini stroke or warning stroke because the symptoms are similar to those of stroke. But they typically last only a few minutes to hours. Maybe you may say some 2-3 minutes or an hour, and do not cause permanent damage to the brain. Other symptoms of TIA can be include sudden weakness or numbness on one side of the body, difficulty in speaking or understanding speech, vision problem, dizziness, and severe headache. These symptoms may be brief and resolved on their own, but they should still be taken as serious as a warning sign of a potential stroke. TIA are a warning sign that there is a problem with blood flow to the brain, and they increase the risk of future stroke. It is important to seek medical attention immediately if you experience any symptoms of TIA, as early treatment can help to prevent future stroke. Treatment for TIA may include medication to prevent blood clots, lifestyle changes, managing underlying conditions such as high blood pressure, high cholesterol, and diabetes. Now, one more case is that is cardiovascular disease, CVD, what we call. Is a group of conditions that affect heart and blood vessels, including the arteries, veins, and capillaries. Even it may extend to tendons also. Coronary artery disease. This is the most common type of CVD which occurs when the blood vessels that supply the heart with blood become narrow or blocked, reducing the flow of oxygen and nutrients to the heart. And second is heart failure. This occurs when the heart is not able to pump blood effectively, leading to a build-up of fluid in the lungs and other parts of the body. Third is arrhythmias. This refers to abnormal heart rhythms which can be too slow, fast, or irregular. And fourth is peripheral artery disease. This occurs when the blood vessels that supply blood to the limbs become narrowed or blocked, leading to pain and numbness in the limbs. And fifth, we can call it as aortic aneurysm and dissection. This refers to bulge or tear in the aorta, the main artery that carries blood from the heart to the rest of the body. Risk factors for CVD that includes high blood pressure, high cholesterol, smoking, diabetes, obesity, a family history of CVD, and a sedentary lifestyle. When we change the lifestyle, such as quitting smoking, eating a healthy diet, getting regular exercise, and managing underlying conditions, can help reduce the risk of CVD. Treatment for CVD may include medication, surgery, or other procedures depending on the specific condition and severity. When a patient undergoes any ischemic stroke, immediately they have to undergo for the conventional system of medicine, where some kind of operation, if required, they will do, or otherwise with injections like ecosprin, the blood thinner, they may take the medications protocol. And after that stroke is over, maybe the post-stroke cases, there we can give a complete relief to the patient through Marma treatment. So in this way, manipulation and stimulation can be done in their arteries wherever the blood vessels are been narrowed or reduced, and the oxygenated blood is not been circulated in their brain streams or in any other arteries or in the blood vessels. So the Marma Chikitsa is one of the supporting tool, we can call it, for ischemic stroke, and today we will also share with you which are the arteries are in the brains that can be manipulated and stimulated through vermology, and how fast we can give relief to the patient. So in our next episode, I would like to give you all the arteries, related arteries to the brain where the ischemic stroke generally takes place. Okay, thank you one and all.